Hello, I'm Alistair McClellan, editor of HSJ. Welcome to the HSJ LGC roundtable on data sharing across health and social care boundaries. We've brought together a group of experts from both the health and social care sectors to debate this very important topic.
In relation to data security, I think the kind of restrictions are appropriate. In terms of data sharing, I think the balance is all out. So, if you talk to a bunch of social workers, either in children's social care or in adult social care, they're going to tell you we find it very, very difficult to be able to access the information that we need in order to fulfil our professional role.
I think there's lots of local areas, and we're working with a number of local areas around the country that have a shared commitment and a shared vision for data sharing across health and social care. And I think that starts from having strong leadership and having a strong culture across organisations in terms of sharing data. But that's not to say that we shouldn't be keeping information safe and secure, and we shouldn't be letting the public and engaging with the public around how their information is being used.
We've done some work recently, and we've undertaken a piece of research looking at how nurses in the community in a whole variety of roles are engaging with the digital world, which includes data sharing, potentially data sharing between health and social care and the voluntary sector in delivering care for patients in their own homes and communities. And one of the really surprising figures that we've derived from this data, it's over 500 nurses completed our survey, is that there are 27% that are still paper-based in terms of their record keeping.
One of the key things we've done recently is publish a report on unleashing the potential of health and care data. One of the things that came out of that report is about building public trust and having a vehicle for health and care data that would do that. We've come up with a health and care national data donor bank where people's data can be gifted to organisations in academia and research to deliver better patient outcomes. We see that as a mechanism of building public trust when it comes to sharing health and care data.
It's now the sharing of information across the health and social care and local government divide that is really the next phase of bringing care wrapped around patients for their benefit and for improved quality of care. And I think that raises questions of the interoperability of the systems that we're working with.
If you give people the right information, they will make the right decision. Okay, so what we found is that when we were talking about what are your views around data sharing your health and social care information, if there was a conversation about it being for primary use, for enabling better care, then actually most responses were, we thought you were doing it already. The actual dropout rate, and there's always some conspiracy theorists that want to drop out, was about 0.2%. In the same conversations, we were talking about care.data, and people understood that, and the dropout rate or the opt-out rate, because we were looking at being a pilot site at the time, was about 20%.
We need to get into a situation where we can start to say, because we shared data in Leeds, we were able to do X, and X is a really cool thing. And I think those stories are probably already out there, but there are not enough of them. I mean, there needs to be a positive story about this is the cool stuff that happened.
To what extent, in your economy that you're talking about, amongst all the partners, are you going to have single approaches around things? Are you going to have single systems in primary care? Are you going to cope with multiple systems in primary care? How does that work in the different community organisations? How does that work in mental health? How does it work in acute? Are you going to do something about that? Because if you can reduce the variability, you can increase the speed at which you can start to join things up and make improvement.